Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. First of all, on behalf of Dr. Ahmed and myself and the entire staff at the Health Unit, we would like to acknowledge the kindness of our community. In the past few days, we have truly felt appreciated and feel the outpouring of support from many of our residents, from our young students to our seniors. Your letters, cards, emails, they mean a great deal to us, and we want you to know that, so thank you very much. I will now report our current case counts. There are 442,069 confirmed cases of COVID-19 in Canada and 134,783 cases in Ontario. Chatham-Kent has 541 cases, and Sarnia-Lambton has reported 440 cases. Michigan now has 421,137 cases, with 22,727 cases being in Detroit. Today, we are reporting 104 new cases of COVID-19 in Windsor and Essex County. Of the new cases, 19 are close contacts of confirmed cases, 2 are community-acquired, and 83 are still being investigated. We have had 4,453 cases since March, 3,747 cases are now resolved, and 620 cases are active and being followed by our health unit. 37 confirmed cases are currently in the hospital, and 7 people are in ICU. In Windsor, there are 73 suspected cases of COVID-19 currently in our hospital. Our community has lost 86 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 25 active outbreaks across Windsor and Essex County. 8 long-term care and retirement homes, 11 workplaces, 2 community outbreaks, 2 hospitals, and 2 schools are in outbreak. In addition, we have 25 schools that have cohorts dismissed, involving over 700 students and staff. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for his weekly EPI summary.
Okay, so good morning everyone, and thank you for joining us today. As we are seeing cases in Windsor-Essex continuing to increase, our region has already seen more than 4,453 cases and 86 deaths that were already attributed to COVID. So today we'll go further deeper into breaking down all this epi data in our region, as well as trying to put some perspective everywhere else in the world. So looking around, what we can see is some of the countries are similar to Canada, have seen an increase, a surge in number of cases. And with appropriate measures, those case counts have been gone down significantly. A great example is to look at in this graph is to look at France, where they had daily new confirmed cases highest rates in the world, which was dropped down significantly now based on the extreme measures that they put forward to control the spread of the disease. Similarly, what we can see in some of the other countries where some of these measures are not implemented or poorly implemented, they continue to experience some of these cases as we're dealing with this pandemic right now. So this graph looks at the cumulative confirmed cases. No surprises, US continues to have the highest number of confirmed cases per million population in the world. And among many of these countries, Canada is still relatively lower, but obviously our case rates have been increasing significantly daily. Looking at the number of deaths, we definitely learned a lot about COVID from the first wave. So the first wave, while it has seen many deaths, the second wave, we are doing much better as the health system, as the country, to protect those lives and save lives. And again, looking at across, comparing it with many other countries, the death rates in Canada continues to be better than some of the other countries that we are showing in this graph right now. Cumulative deaths, as we can see, overall cumulative deaths in Canada is slightly higher than Germany, but still much lower than many of the other countries that we are seeing in the world. So now focusing on the Ontario, and this is the daily newly reported cases each day in Ontario, and as we can see, the second wave is continuing to increase at a rapid rate throughout the province, and we can look at the first wave, which is right now it almost is dwarfed in front of what we are seeing in the second wave. And this shouldn't be coming as a surprise to many who knew that the second waves in these type of pandemic is generally much worse than the first for several reasons. And unless we recognize the impact, unless we recognize the number of hospitalization, the potential impact on the lives of many people, we will not be able to bring these case counts down everywhere. So focusing now entirely on just Windsor-Essex, and this is what it looks like. This particular epi curve is created to show the number of confirmed cases by date. It was reported to public health, and as we can see that throughout the summer, we have seen some fluctuation in the number of cases. But right now, starting in November, we are seeing a steady increase, very sharp increase in the last 1 or 2 weeks, which is really concerning for our community because the cases that we are seeing is spread out pretty much in many sectors right now. So looking at just focusing on what is happening from September to present, this is what the data looks like. And again, we did very well in August, early September, pretty much the entire month of September, up until mid of October and leading into all the way end of October. But starting November, things started to get really worse, and it continues to get worse as we move along with this second wave. Looking at the cumulative case counts, and as explained previously, the concern is when you're looking at interpreting this graph, the steepness of the curve is something that you are looking for. And as we can see, how quickly the cases are accumulating, and we reported the last 1,000 case between 3,000 to 4,000, we crossed that line in just 25 days. And since reporting that, we are already now coming close to 500 cases since we last reported that a few days ago. So our next 1,000 case counts could come in even less than 25 days that we reported before, which is something that we all need to be mindful of. From a weekly case rate perspective, this is what it looks like overall. And as I've been talking about the second wave and how it's impacting, our most recent completed weekly case rate is 106.6 cases per 100,000 population, but this will increase since week 50 is still ongoing, and the final bar in this graph is probably still capturing new information as it will present to us. But comparing that again with the first wave and the steady increase, it is concerning for our community. As we presented this data last time, the Health Unit has been collaborating with researchers from University of Windsor through the Great Lakes Initiative for Environmental Research, specifically Dr. Mike McKay. And one surveillance tool currently being explored through the partnership is the use of wastewater data to determine the prevalence of COVID-19 in this community. This particular graph shows the average ratio of COVID-19 virus to the pepper-mild mottled virus, and the results are then plotted red line against the confirmed cases of COVID-19. What we are finding now is, and what we have found in other regions as well, that the prevalence of this virus in the wastewater signifies some of the trends that we are seeing in the community with respect to the community cases, and this trend is also currently being reflected in our data right now. There are some gaps in the data because of the sampling methods and how frequently it was being sampled. And looking at the interest in the data, we are obviously working with the university and looking at exploring the possibility of doing more sampling of this data to get a better picture of what's happening through the wastewater, and then put it together for what is happening in the community and try to make some sense out of it. with some gaps in the data. It's not a perfect system, but what we can see still there is a significant correlation between what we are seeing in wastewater with the active cases or the confirmed cases in the community. We'll continue to monitor that, and we'll continue to share that information with the community. Okay, looking at our weekly case rates and comparing ourselves with Southwestern Ontario as well as with the province of Ontario. The line in blue is the line for Windsor-Essex rate. We were much higher than the provincial average back in the summer with our farm cases, and then we stayed below the provincial average as well as the Southwestern Ontario average for quite some time. But now we have seen, starting from week 44, week 45, a steep increase in the weekly case rate, and now we are surpassing the provincial case rates very quickly. Looking at the percent positivity of all our cases that are reported to public health, so in total we have completed as of November 28th, 151,732 tests, and the percent positivity up until that week was 4.5%. And this has not changed from the last week, as we can see that the percent positivity increased starting from October, but then now it's plateauing, which is similar to what they're seeing in the other region. Looking at comparing ourselves with the rest of the communities in Ontario, we are currently ranked at number 5 with the percent positivity data that we can see in the province of Ontario. Lower than the Peel, Toronto, York, and Durham region, but with our cases increasing, we might see some changes in that number. This graph looks at the data that is available to us. Approximately 40% of the tests are still being available within 1 day of being tested, and 79% of the test results are being processed and available to us within 2 days. This is just looking at what is happening since September, and again, the number we've seen some decline in the number of tests that is reported to us quickly in the month of September, early October. But now, over the time, it is fairly stable despite some of the pressures and the challenges that the labs are seeing right now. Looking at what our case rates looks like provincially and regionally, and this is a cumulative case rates, and what we are seeing right now is we are at number 4 in terms of the case rates in the province. From Peel, Toronto, and York continues to have the highest case rates in the province. Looking at just our municipality, what we can see, and this is the cumulative case rates, and comparing ourselves with Leamington and Kingsville, those are the two the municipalities that has seen most of these migrant farm population, and because it is factored in based on the population size, and that's why we're seeing the rates higher in those communities given their smaller size but high number of temporary foreign workers, and many of them getting infected by it. Similarly, the other municipalities haven't seen many of these cases, and they are pretty much comparable, except for City of Windsor with their high population density and the size of the population that lives in City of Windsor. Just focusing on the data from November 1st to present, and again, a similar picture. Leamington continues to have the high number of cases, mostly due to their temporary foreign worker population. But then overall, from the rest of the municipality, Windsor, City of Windsor continues to have the highest rate in the region, followed by Kingsville, and the rest of the municipalities are fairly comparable to each other. So what has the overall distribution of cases since the beginning of this pandemic? What we have seen is the City of Windsor continues to contribute to almost 46% of the cases since the beginning of this pandemic, followed by Leamington and Kingsville, while the rest of the municipalities have 2 to 3% of the cases overall. Just in the last 30 days, City of Windsor contributed to 2/3 of all cases in the region, followed by Leamington and Kingsville, while the rest of the municipalities are still similar to what they were before. Just in the last 7 days, City of Windsor case rates are increasing, and now it stands at 70% of the cases in the region, while the rest of the municipalities are still seeing some activity, but not to that level of what we are seeing in the City of Windsor. So looking at the age and sex distribution of cases, this is overall picture in the green, which basically showed the highest case rates were between the ages of 20 to 29, followed by the age group of 30 to 39. And similar trends we're observing in the last two weeks, except for the group between 0 to 19 years, and a lot of them is from the school cases that we have seen more recently in our region. Just looking at in the last 2 weeks from December to present, and this is what the picture looks like, which is pretty much similar to what I've shown earlier. So this is a new graph that we added just to give you a perspective on what the epi curve of school-age children, which is between 4 to 18 in Windsor-Essex, looks like from March to December 2nd. And as expected earlier on, with limited interaction of students and children not going to school because of school closure, we didn't see many cases in that age group. But as we can see, even in the month of September, we when the schools were opened again, we didn't see much of the increase. But in the last month or so, we are seeing a steady increase in the number of cases overall, which is almost reflective of what we are seeing in the community. So whatever proportion of cases increase that we are seeing in the community, we are also seeing some increase in the school cases. And as Teresa mentioned, the number of cohorts and the number of students who are dismissed or impacted by it, so that number is also there for us to look at. So this is the picture of what it looks like in the province with respect to the cases below the 20 years of age, starting all the way from March to December 1st. And we can see that there was a steady increase in the number of cases starting September, which is signaling to the fact that the school season, when it started, there has been some cases that are increasing overall, which would be reflective of what we are seeing again in the entire province of Ontario when the cases started to increase. So this is the percentage of school-age children, which just looking at Windsor-Essex, how many percentage of school-age children in our region contracted COVID compared to how many contracted after the reopening of school. And we can see the difference between those two bars as prior to school reopening. Our case rates were at 3.9%, and then after school reopening up until December 2nd, that rate has not only doubled, is almost 3 to 4 times higher than what we were seeing before the schools were reopened. Looking at the acquisition sources of how these children are getting these cases, obviously the most important contribution that we can see is from the close contact, and after the schools open, because most of these children understandably have limited activity and limited exposure outside of the school environment, and the exposure, the cases are acquired generally through their family members, and this has been consistent in what we have seen in our region. So looking at the percentage of grade JK and grade 3 prior to school reopening and after reopening in Windsor-Essex, and the purpose is just to make that distinction because of the different requirements, different restrictions based on this age group versus anyone who's in grade 4 and above. So we were interested in looking at that data, but again, similar picture what we have seen with the overall picture of students in our region. So it's not different in terms of what we have seen overall. So the contribution of these cases is pretty much similar to this age group versus the rest of the age group. This EpiCurve look at the acquisition source exposure type by exposure type in schools. Again, this is just the data from Windsor-Essex starting from September 8th to December 2nd. And what we can see is the contribution of the exposure source in most of these cases. So we have seen a lot of these exposure type identified as community based in the month of November, and then leading into some cases in December as well. But majority of these cases continue to be from household contacts, which is in blue shade in this particular graph. A lot of them is also linked with the outbreak, which is represented with the green color. Okay, so similar data from the province. This is what it looks like, starting all the way from September, with the majority of the cases resulting from close contacts, and that number continues to increase steadily. And part of the outbreak, limited number of cases that were linked to the outbreak cases. Looking at the, now switching gear back again overall to our community, the overall non-EpiLink cases in our community is currently at 27%, standing at 27% of our overall case counts. The breakdown of exposure history by reported date is presented here, with majority of these cases, as we can see, is still coming from either as a household contact, but a significant number of cases are increasing as a result of community transmission. We have seen some up and down, but those numbers have been pretty steady, especially since the middle of November. We are seeing an increase in the number of cases that are coming from community. The number of outbreaks that we have seen in our region is increasing at a rapid rate as well. And back in the time when in early October, we had no outbreaks, active outbreak. But right now we're standing at, I think Teresa mentioned 21 outbreaks today. So we have rescinded some of the 25 reported today. So obviously this number changes depending on when the data was presented. But just looking at the contribution and the involvement and the effort that goes into containing this outbreak by our team and the facility themselves, it takes a lot, and most of these cases are active outbreaks is obviously as a result of the many cases that we are seeing in the community. And that is why it is important, especially for people who work in these high-risk settings, such as healthcare and long-term care home, retirement home. It is absolutely critical for them to be mindful of everything that they're doing, because any cases that are resulting because of cases introduced into these facilities, it can be devastating for the entire facility when it can spread quickly. So especially at this time, when we have lots of community transmission happening, it is important for anyone who's working with high-risk vulnerable population to be extra vigilant to make sure that they are not bringing it in the institution. So the hospitalization and ICU, we've been talking about it for the pressures in the acute care system, and that is increasing at a rapid rate, as we can see, starting all the way from June, when in the worst part of the first wave, we didn't see that many cases in the hospital as a result of COVID. And clearly that number is increasing, and it will continue to increase. It's basically just a function of how many cases we are seeing in the community. Our previous data has already shown that at least 10% of these cases, what we are seeing in the community will end up in hospitalization, and then some of those individuals will go to ICU and some will die. So put those numbers into perspective. If you have 1,000 cases, that means at least 100 of those cases will end up in getting hospitalized, will add pressure to the hospital. And then based on our data of let's say 2.5% of our fatality rate, that means at least 25 people will die. And I'm not making that comment lightly. People will die with all these increasing number of cases, and it will be really unfortunate for anyone who could potentially be the person who introduced these cases in either in a high-risk setting or in any setting at all, which resulted in the death of someone. So we have to recognize that the importance of following these measures and doing some of these things. It's just not for us. it goes beyond us, and God forbid if we are the one who is the cause of any fatality or anything that happens with this population. Looking at just from September to December, again, similar picture. I've already talked about it. So moving on to the COVID-19 hospitalization 14-day average, and as we can see, the average is increasing at a rapid rate. The acute care capacity, it is already stretched to 90%, but again, those are some of the calculation that we make based on the number of beds. It doesn't factor in that how many of them are isolating, and based on the isolation, there may be limited ability from a space perspective to admit these patients. And also recognizing with some of the pressures that we are seeing because of the outbreak in these two hospitals, their ability to move patient, the flow of patient, it will continue to be a problem. So it's not only just the number that we can feel good about it, that we still have 10% capacity. In reality, we don't. It is already above 100% capacity, but in the effort to be more transparent with the data, this is what the data looks like. But again, mind you that the actual capacity is exceeding 100% already at this time. This is about the critical care capacity. So the ICU bed capacity, again, it's almost touching close to the point where it's getting more and more difficult with very limited options to put someone in ICU, whether we are talking about just COVID or for anything else. And then this is the data overall for the critical care capacity in the region. Vented critical care capacity, so anyone who requires a vent, again, that number is also increasing in the last couple of months. So where are we with all these cases? Almost 84% of these cases are resolved. There is still 7% of the cases are self-isolating, and that number is increasing rapidly because of our high number of cases that we are reporting every day. And unfortunately, we have lost 2% of our population to COVID right now. Among the age and sex breakdown of COVID-19 deaths, while we have most of these deaths happen in individuals 80 years and older, we have seen some of the unusual deaths in the younger group as well. And as we reported this week on its own, the 27-year-old individual who passed away with no pre-existing condition, those are some of the things that we don't know about this virus. We don't know many things. We know few things. That's why we can see some differences in terms of how we are trying to manage these cases and preventing some of these deaths. But there are still a lot of those cases that are we don't know, and there's a lot to learn about this virus at this time. So looking at the case fatality rate overall in Windsor-Essex, it's at sitting at 2%, which is below the provincial average, which is a good sign. That means that our health system partners and our health system is responding better compared to the provincial average. Even comparing just at the long-term care home outcome with our regional long-term care home outcome, it is much better than for the provincial average. And make no mistake, when we are talking about these 2% cases overall in the community, that means that that number is, you have to put that into perspective and always think about 1,000 cases. That means 20 people will die. And that's what the number we should be looking at. And then also, those individuals may be younger, healthy, they can survive, but they can potentially be a carrier or disseminator of the virus to someone who could be at a high risk of dying. And then they could be the source of passing it on to someone else who could potentially die from this virus. So this number is not to be thinking that, oh, it's just 2%. It's not 2%. It's 20 people in every 1,000 people that are contracting the virus. Looking at the day-to-day doubling time comparison, and then the line in blue is Windsor-Essex, and just looking closely from September to present, we were above. That means we were doing much better, and now that that number is going down significantly, and our case doubling rate time right now is close to 20 at this time, which is much lower than what the provincial or the national average is. Our median R not effective is 1.33, and it has increased in the last few days, so signaling that there is still a significant ongoing community transmission that's happening, and new cases are resulting in more cases. And if that trend continue, we will be on the verge of seeing hundreds or more than hundreds of cases every day. And it's unfortunate that we are reporting more than 100 cases for quite a few times this week. And we were at a point when we were reporting less than 10 cases. So it is really disturbing and concerning for us as the entire community, that where we are heading and what kind of impact we have. And as I've always indicated, that the hospitalization and death is a lagging indicator. With our current increase in these cases, we will see more people hospitalized, we will see more pressure in the healthcare system, and we will see more people dying. So this is something that we all need to repeat and remind again, what our impact, what kind of impact we can anticipate and what we can do to prevent it. So in summary, the case rates are increasing at a rapid rate, much higher than the provincial rate, and the acquisition source is distributed pretty much everywhere, and that is indicating a widespread community transmission. And even when we are saying about 27% of the cases are a result of a community transmission, but if we are reporting 100 cases, and 27 cases we don't know how they contracted, that means there may be much more cases in the community that either they don't know, or either they are symptomatic and not going to get tested, or they're not isolating, which is a significant concern in the community. So it is really critically important that, as we talk about every day, we have even sent out this media a release to remind people about their obligation, to remind what they can do to prevent the spread of this transmission in our community. Our hospitalization rate continues to increase and is putting pressure not only just in Windsor-Essex, but also in the surrounding community, because of our inability to admit many of these patients because of these pressures. Because we have to remember, Windsor-Essex is a hospital, also serves some of the neighboring communities, and with the London Health Sciences outbreak in London, it is putting a significant pressure regionally as well in the acute care system. Our day-to-day doubling time in Windsor-Essex it decreased dramatically, and it's worse than the province of Ontario and in Canada in general. And the R0 is effectively indicating that there's the transmission is increasing in the community, which is opposite to what we would hope with all our messaging and with all our support that we are trying to provide to the community. We've been doing a lot of work to provide that support to the businesses, to the individuals, by providing them with solution tools, ways how they can do everything safely. But somewhere something is missing, and we want to make sure that people are getting the right source of information and not falling into the trap of misinformation. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. I guess looking at the schools and the announcement yesterday that schools are going to be ordered to close starting on Monday, what do you say to the other medical officers of health who suggest that closing schools won't actually, or will actually cause more spread, not less?
Well, let me just clarify that we didn't ask for the schools to close. We asked them to switch to online or remote learning. Secondly, I think our data is what we are looking for, and we look at all the data that is available locally to us, and working directly with the school boards, we have a better understanding of what is happening in Windsor-Essex. Every community has different issues, so obviously I cannot comment on what they are dealing with or what their concerns are. My concern is Windsor-Essex, and we have to make that call based on our local situation. And again, it has nothing to do with the safety of school in general. It has to do with what cases we are seeing in the community. And obviously, every time you have an increase in the number of cases in the community, you will see a spillover effect on in the school. You will see a spillover effect in the long-term care home, hospitals. It will spread everywhere. So when we are talking about the safety of the school, there are a number of layers of protection that was put forward when the Ministry of Education, Ministry of Health, all these guidelines, is to provide that layers of protection. What we are feeling based on our case rates, we need an extra layer of protection for these students, because otherwise there may be a possibility that it can get worse. So we made that decision based on our local data and our local understanding of the situation, and let's hope that it would not significantly affect anyone. And when we made that call, we recognized all the pressure. We recognized all the pressure that some of the families have to go through in finding some support, especially for a single parent who have to leave for work, or for families with limited ability for childcare, and if they have to work. So we get that. It is a difficult choice, but it's not the end of the world. It's just 1 week we are talking about. This is just 1 week prior to the closure. We're hoping that that would provide the extra support and extra layer of protection to our children, and will also help our community more broadly by reducing that number of cases that we are seeing in the region.
Okay, thank you.
Any questions from CBC?
Hi, yes, good morning. During Dr. Williams' briefing yesterday, he said something interesting about how the way in which we've seen cohorts dismissed, the rate at which and the number of cohorts that have been dismissed in our region is different than what other parts of Ontario are seeing. And I'm just wondering why you think we're seeing more of that here.
Well, I guess the rapid increase in our cases is probably the contributing factor, because if you're having 100 cases today, as we reported, 103, I believe, and so that means even if you have 4 or 5 school-age children in that group, that means 4 or 5 school dismissal. And that's a lot in 1 day, given the number of the cohorts and the number of schools we have. And in some of the other urban regions or other areas, even when you have 100 cases and the number of cohorts, the proportion of cohorts that are dismissed would be much lower than what we are seeing here. So the sudden increase every day, if we are dealing with the same number of cases or the trend increasing, it definitely puts a lot of pressure on everyone. And again, when we are talking about the pandemic response, we also have to factor in the ability for the public health to meet the needs of the community. We also have to understand the ability of the acute care system to test all these individuals who need testing, and then provide care, and also if anyone who needs hospitalization. So in making those decisions, we factor that in as well, that our ability that dismissing a cohort and going through the schools, it takes a lot of our time as well. And whether this is something that we can prevent or not, and what kind of an impact it would have in the community. So we did factor that in, and we're hoping that with this sudden increase, if this is something that we can do to put an additional layer not only on the student, but also a protection for to prevent any further rise in the cases in the community. So that's what drove our decision to this.
And I also want to ask, it is just for the week, but your news release said that it could be extended depending on how the numbers go. So what should parents do? Should they prepare for an extension of this into the new year?
Well, I think the only thing that I can say about this pandemic, that the pandemic changes. We have seen the worst, we have seen the best. We don't know what happens. So even though as much as even I want to plan what I will do tomorrow, but depending on what happens here, I don't know what I will do. So it's unfortunately that I cannot answer what to prepare, but just keep watching the numbers and see where we are and how are we doing as the community. Right now, I think the case rates, the community transmission is high enough that it is a risk. It could change, it could get worse, it could get better. So I don't want to say what will happen, but we will obviously keep a close eye on it, and we will also see the impact of it. So we want to see if the students are all dismissed for a week, did that have any impact on the overall case or the overall transmission? It's a short period of time, but it may give us some indication of what lessons we can learn, and then maybe we can use that lesson to apply it moving forward as needed.
Thank you.
Any questions from Blackburn?
Yes, good morning. Just to that point about the transmission, I know that all of the data shows that there has definitely been an increase of the number of cases within school-aged children, but the transmission, as your data has showed, has come from close contacts, has come from their parents. So I've seen some comments online that, you know, if there's not a lot of evidence that this transmission is happening on schools, I guess what is the justification to close the schools if the transmission isn't happening there?
So
for the most part.
Yeah, so I answered that question partly, and maybe I'll just repeat it. So first thing is, just by default, you know, when you're trying to, all these plans that we have for school, it's based on what the community is doing. If your community is doing poorly, if your community case rates are high, you will see cases in the school. And then you will see all this disruption. And at any time, those cases can turn into an outbreak that we have seen in one of the schools here in Windsor. So there is that risk, and it's all about risk calculation and risk mitigation and risk assessment. So when you have many families with active cases, there will be children who will contract COVID, who will go to school, and then can potentially spread it to others. So that's one reason. And obviously the other reason is when we are talking about these layers of protection, I think we have to go back to remembering these are all the layers of protection that we are talking about in all the school plans. So even if you remove one layer that expose these people or increase their risk, with the background risk in the community high, that increases their overall risk of having an outbreak and having more children affected by it. So we can see that if in a community where you have high rates in one of the schools that we have seen, it resulted in that. And again, a lot of that is, what are we trying to protect and who are we trying to protect? And what is the solution? If the solution is, from my perspective, we're trying to protect the health piece. What are the other concerns? We are not compromising on the education side of things, because we did say that, you know, switch to online learning. This is a different year. We can argue a whole lot about, and I am a vocal advocate and supporter of having an in-class learning, because that is definitely a much better learning environment. But 2020 has been a year where many things have been changed. A lot of compromises has been made. So what we are trying to do is we're trying to balance that, and we're trying to make sure that we are not putting and adding any additional risk to these children, and that's why we made that decision.
And I guess to your point about it'll also kind of hopefully relieve some pressure for case management. Will those school nurses now be able to switch to case and contact management?
Well, I'll let Teresa answer that question, but as we have already talked about, with the number of cases, there's already a lot of mobilization that's happening all the time to find the most efficient way, but I'll let Teresa respond to that.
So our school nurses that have been supporting the schools have been trained in case and contact management, and have actually been taking on the cases related to school-aged children and their families. So we will continue to do that. You know, continue to use the school nurses for the case and contact management follow-up.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Dr. Ahmed, do you anticipate that if the province does put us into lockdown later today, if we do go to lockdown, will you have additional restrictions that you will be announcing?
Well, let's wait for the decision first and see what the decision that province make. And obviously, we like to make many of these decisions based on the evidence. And we have heard some concerns in some areas, so we will be looking at that. So it really depends on what announcement is made by the province, and we'll have to revisit that. So I cannot preempt what to expect and what kind of restrictions that we will consider.
Okay, and then Teresa, you said there was a big outpouring of support for the health unit and you appreciated it. Is that outpouring of support new? Have you seen that before? When did that start coming in?
So all along, we do get emails and, little gestures of kindness to our nursing staff and to all of our staff, and especially to Dr. Ahmed. And but I have to be honest, the last couple days, there just seems to be, a real influx of really nice emails, letters from students, from school students that actually have been part of the dismissed cohorts and valuing public health nurses and hospital nurses and, indicating they're following the public health guidelines. We received, just really nice emails from faith leaders in our community and residents of Windsor and Essex County, and it really has been, I'd say yesterday and today they continue to come in, so it's been really nice. We know there's a lot of messaging going out from our health unit, and with the school messaging and the school release of cohorts, it is disruptive for parents, but the people that take the time to, just let us know that they're appreciative means a lot to our staff who, as you all know, continue to work through this. So it's been nice.
And then separately, I believe you said there were 73 suspected cases currently in Windsor hospitals. Are those people that are pending test results, or they? I might be a better question for the hospital, but what can you tell us about those individuals and why those aren't the 37 hospitalized people right now?
So the numbers that we report for the 37 people are actual confirmed cases of COVID in the hospital, and then the number of positive people that are in ICU. So today our epidemiologists flagged the fact that there were so many other people that were suspect COVID. So they're not cases, they haven't, they're not positive at this time, but they probably have signs and symptoms. But you're right, the hospital would know more details, but it was flagged by our epidemiologist who is tracking all the data for Windsor and Essex County.
Okay, thank you.
Any questions from AIM 800?
Good morning. I was just wondering, the positive cases that we are seeing now, are those still cases that the results were pending from when we were still in orange? And if so, then when will we start to see the results of people who were getting tested during being in red?
So I don't think that those are the cases that we are seeing from orange. I think most of the cases that we are seeing right now is from red. And as I mentioned, that the lab turnaround time has been fairly stable. 40% of the test results are coming back within 1 day, which is a good sign. And obviously they have worked a lot to streamline some of that process. Some of the pressure that we have seen in the past is the time to book appointment for testing. There has been some delays on that, so there may be some element to it, but I cannot think that it caused that much delay that we're still seeing results from the orange. I just truly believe that what we are seeing right now, especially now, it is all from red.
Okay, and so, with the typical Friday announcements from the province, obviously you've had multiple conversations with Dr. Williams recently, especially with the school closure. So did you recommend to him that we move into gray, or, can any insight into that decision?
Well, obviously, we always talk about the data. We always go into the qualitative side of the data as well. We consider every aspect. We try to figure out all the potential solutions that we can do, and some of the measures that I am thinking, or some of the measures that the province suggests at times, depending on what they are observing in other places. So all of those conversation happens regularly. And with those numbers and data is already presented to them, and they will pass on their recommendation to the cabinet, and hopefully they will make the decision, and we'll wait and see what decision they make.
Okay, thank you.
Any further questions from CTV?
Yes, hospital officials say that Windsor-Essex will get 2,500 doses of the COVID-19 vaccine by the end of the year. So how do you decide the priority of who gets it first and when?
So the prioritization, there is a number of guidance that our National Advisory Committee on Immunization has put forward. Obviously, it doesn't go into the deeper details of some additional context that we need to look at. And irrespective of how many doses we get, I don't have a confirmed number how many doses we'll get. Obviously, there is some estimation that we can all make that based on some of our conversation. But that would be a challenge, and depending on our ability to vaccinate who, because there are some criteria that we have to consider with the vaccine that is the Pfizer vaccine that's approved in Canada for use. It has a strict requirement with storage, and depending on our ability to mobilize this vaccine or inability to mobilize this vaccine, it may have an impact on the decision making. So the recommendations obviously would be at a broader level is for those who have a higher likelihood of developing more severe consequences of the disease. So those are the priority group, which we can all understand that could be people in the long-term care home, retirement home, and all those places, or people with severely immunocompromised condition. And then the other important group is the healthcare worker who work with this population. So basically, if they are immune, then they won't contract and they won't bring the virus into those type of high-risk settings. And for the healthcare workers that are taking care of these COVID patients or working in ICUs or in other places, which could be an area that we'd like to protect. So there are a number of high priority groups already identified, but looking at the doses and getting some of those additional details will help to do our local planning. But those are the general framework that we use to make a decision on the vaccination.
And if we're in a lockdown versus red, do you expect we would get more and sooner? Like, would that actually be a good thing for the region as far as the vaccine?
I don't think so at this stage. Obviously, we know that because of our high case rates, Windsor-Essex, to my understanding, will be a priority anyways. In the short period, I don't see that changing. It all depends on the supply and demand. We know that we will get some supplies. I don't have the exact date when we will, but we heard that we will get some supplies. As soon as it comes our way or we get some confirmation, we are already working with our partners, mainly our hospital partners, to roll it out immediately. So that will happen. But then again, there are other vaccines that are soon to be approved and more supplies will come, and that would change the whole dynamics of how quickly we can vaccinate, and all of those considerations will be there. But I know that Windsor-Essex will be a priority based on our conversation.
Okay, thank you.
Any further questions from CBC?
Yes, I have one more question about the lockdown. I'm just curious, why is it that our local health unit and you, as the local health unit, you don't know at this moment in time whether or not we will be moving into a lockdown or not? I just wonder, is that frustrating to you that you don't know what decision is going to come down in a matter of hours that would impact our region?
So Katerina, what I can say is the final approval authority is the cabinet. I wouldn't say that I don't know what our recommendation is. I think we made our recommendation, but based on our recommendation, still the final approval authority is the cabinet, and through cabinet, the premier. So I don't want to preempt to something that is beyond my decision. So we'll have to wait and see what the cabinet and the premier decide.
Okay, I understand. I also just want to ask, there seems to be a bit of a discrepancy in the reporting of deaths. Last night, the hospital said that they've seen 6 deaths in the last 3 days, and that some of them may not have yet been reported by the health unit. Can you explain that?
So, okay, go ahead, Teresa.
So we do get reports of deaths, and we don't report them until they actually come through as COVID deaths and that are confirmed. So you may receive other reports of deaths, but until they're confirmed with our information, we don't typically report them.
Okay, thank you. And if you don't mind, I just have one more question. From the data that you shared today, there seems to be more unknown cases than self-isolating active cases for the first time that we've seen, if we're not mistaken. So I know we've asked you a lot about contact management, but are we at an even further tipping point today?
So I haven't looked at the exact outstanding, the nursing assignments, but as they do the interviews, the numbers should improve on the unknown or the under investigation. They continue to work and try to, address all the people that are awaiting phone calls and that have tested positive and their contacts. So we are using all of our resources. I'm not exactly sure of the exact details of that though right now.
So Katerina,
Thank you so much.
I think you're referring to the graph that I put forward for current outcomes. Is that the graph that you're referring to?
Yes, I believe so.
Yeah, so as Teresa is right. So some of that is that, and also because this data is pulled through our case and contact management system, and sometimes if the case is not closed, that means that there are still some ongoing discussion, even though we know what they are isolating. But if they are not closed, based on the reporting, it will show up as unknown. So there may be some of that issue as well. So in theory, the self-isolating number would be higher than what we are seeing here, what we present in this graph.
Okay, got it. Thank you so much.
Any further questions from Blackburn?
Yeah, I think it was late last week, or maybe it was just early this week, maybe I'm losing track of time. But Teresa, you had said you were optimistic that, you could catch up within a week to 10 days with the staff that was onboarded from the province. With the, over 100 cases over the last couple of days each day, has that estimate changed? Are you feeling more that maybe that was too optimistic, or how is that looking? Is the staff making a difference, do you think?
So I do think the staff are making a difference. We do appreciate all the staff that the province have given us, and as they become more familiar with our practices, and the productivity increases as well. And I think our messaging this week has helped. I think people are waiting to hear from us. We have the assessment center. If they're making contact at all with people, they're giving some public health messaging. So yes, it was optimistic at that time. Our numbers were not, in the triple digits, and that's seems to be the pattern right now. We continue to investigate other means to help with the cases, but our nurses have a good attitude, and so I'm having a good attitude that we will continue to plug away and get through these cases. And in the meantime, we just urge people, if you have already received your result online and you're positive, stay home, isolate, and as well your household contacts need to isolate. So, so many things change in a week, that's for sure.
All right, thank you.
Any further questions from the Windsor Star?
Yes, in terms of the number of people being tested right now, Dr. Ahmed, the graph that you showed with the percent positivity by week by all tests, the most recent week is week 46, November 21st, with about 8,000 people tested. Do you have any more up-to-date testing information than that?
So we get that data from the province, and because we rely on them, and that would be the most up-to-date data that we have. Our epi team use that data, what we receive from the province. So I guess that's the most recent information. Any changes we'll present probably next week.
Okay, thank you.
Any further questions from AM 800?
Yes, I'm just wondering, it's been announced that Windsor Regional Hospital is going to be pausing non-urgent surgeries starting on Monday. Is this something that you were consulted about or needed to be consulted about? And just what's your opinion on this move?
So we do have a health system table that I participate in as well, and I provide them with more data, more detail, more information. It's not a decision that I would say that I have made or I recommended that, but recognizing that that's their jurisdiction, and they also get some of those directions from through Ontario Health, which is overseeing all of these hospitals and their capacity very closely, and some of this direction comes even directly from the province. So to answer your question, not my direction, but that doesn't mean that I disagree with that. I can totally understand the pressures. We did talk about all the numbers that we have seen, and hopefully that this is not something that's long term. And once we start to bring those numbers down, we can get back to providing those care to our community.
Okay, thank you.
Okay, thank you, everyone.